everyone, my name is Brianda Rodriguez and I will be demonstrating how to perform CPR on an adult. So a little background info, I am already CPR certified since my senior year of high school and I'm currently in my second year of college. Now let's begin the demonstration of the CPR process. Before we do so, let me explain some important information you all should be aware of. First, before approaching the scene, check the scene for anything that can potentially put you in danger or any of the bystanders in danger, including the victim. Like, for example, if there's a fire or broken glass, etc. And depending on your situation, you plan your next move from there. Then, if the area looks clear, you can approach the victim and tap them on the shoulder. You can even shout out something to them just to see if they're alert, if they're responsive. For example, you can say, hello, hi, can you hear me? Are you okay? And depending on the response you get, if you get no response, then that is a clear sign that the patient is unconscious and unresponsive. So therefore, the next step that you would do is either shout out for help if you don't have a phone, or if you do have a phone, call 911. After doing that, you're going to want to check the person's pulse and to check to see if they're breathing. So in my class, I was taught to look, listen, and feel. So to look, you can get lower to the person's level, the chest level, just to see if the chest is rising and going down. You can also check, you can also listen. You can sometimes you're able to hear a person breathe, inhale or exhale. And for the feel part, this is where you're going to want to get your ear close to their nose, and you're going to want to see if you can feel the warmth of the exhalation if they're breathing. And depending on the outcome of what you evaluate, then that's what we see if we continue with the CPR process or not. And if the person is not laying down on their back already, you might want to place them on their back just so the CPR cycle process is a lot smoother. Excuse me. Also, you're going to want to do that according to the situation. So what do I mean by according to the situation? In my previous statement, what I mean is that if the patient has a neck or a spinal injury, then it is best to leave the patient at the position that you have found the patient in, just in case anything else can potentially break. It is just so you prevent worsening the incident. Now let's begin the CPR. So for the CPR process, I'm going to perform it on my stuffed animal that I won at the fair, because I do not want to injure anyone doing this. So we will begin CPR process now. Now for the CPR process, you're going to want to start by placing the heel of your hand on top of the chest, directly on top of the chest, and level out your fingers with the armpit of the person's armpit. So a little side note that my high school teacher / doctor taught me is to place your strongest hand on top of the chest first. So my strongest hand is my right hand. And then next step is you're gonna want to place your other hand right over your other hand. And another side note that made it easier for me to perform CPR was with the hand that I placed on top of the other hand, I just sort of grasp the other hand with it just so I have a better grip and so my hands are not moving so much. And also my high school teacher taught us to keep our heels of our feet together, just because it provides more force and stability, so you're able to perform CPR at your best ability. And now we will begin 30 chest compressions in a 15-second time span. And usually with these, I count up to 30 compressions out loud, just so I don't mess up with the numbers in my head, or just so anyone else that is part of the cycle rotation can hear me, so they're prepared for when they have to rotate. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. And during the compressions, you're going to want to push deep enough into the chest where it's about 5 to 6 inches deep, or to the point where the color on their skin changes. So usually with that sign, you'll be able to tell by the face, the color of the face will appear to look a lot healthier as you compress. And also, when you're doing the compressions, the chest compressions, you're going to want to make sure that your shoulders are directly over their chest, just so you have a strong straight arm form, so you can provide the enough appropriate force to get into the 5 to 6 in depth of the chest compressions. So right after you perform those 30 compressions within the 15 seconds, you're going to want to do the 2 breaths. So for this, you're going to perform a head tilt and chin lift maneuver move. So this is what they taught me in first responders. So you're going to want to grab the patient's head. Let's say the patient's head's like this. Tilt it up. And then the chin lift, you're going to open the chin slightly. And from here, you're going to want to put your mouth onto the patient's mouth and give 1 deep breath. You're going to want to turn to the side, taking a deep breath to perform the second breath. And after you're done, you're going to want to make sure, when you're giving the breaths, you're going to want to make sure that you can see the chest rising, just to ensure that the air is going into the chest and not into other pipes. That's just another thing to keep an eye out for, just to make sure once the professionals arrive to the scene, you can let them know what you witnessed, just so you can help out the professionals better. So after you tilt the head and the chin and you give the breaths, meanwhile you're doing the breaths, you're going to want to pinch the patient's nose, and just so the air doesn't go out through the nose when you're blowing air into the mouth. And from here, this is where you're going to want to perform the CPR cycle. So the CPR cycle involves the 30 compressions, chest compressions, along with the 2 breaths. So you're going to want to continue to perform this until you see signs of life. So a sign of life is if the patient starts to breathe on their own, you can hear a pulse, you see them maybe twitch a little bit, move. The twitching is kind of normal, but if you tend to see that they're spazzing and stuff like that, then the situation can escalate from there. Excuse me. And once another professional or more qualified person, like a EMS or a trained medical professional, arrives to the scene, then this is where you can step back from the patient, just so the professionals can handle the situation according to their game plans that they have. And also, if you have another person with you witnessing it, that they can help join in on the CPR cycle, just because it does tend to get a little tiring around the 5-minute mark, or even less, depending on the type of person you are. And you guys can set up a rotation plan. So after every 2 cycles, you guys can switch, just until you see a sign of life, or until you see a professional arrive to the scene. And this is how you perform CPR. Thank you so much for watching.